Hello, I'm Horst Stipp with the ARF, and this morning we're talking to Dr. Carl Marci. Dr. Marci is the co-founder, CEO, and Chief Science Officer with Innerscope Research. I think you started in Boston, and I think that we should start for you to tell us a little bit more about the kind of methodologies you use in your research, maybe your background, and what led you to those kind of methods.
Sure.
And how do you think those methods can best be used?
Sure. So Innerscope Research believes that unconscious emotions, direct attention, enhance learning and memory, and ultimately drive behaviors. And that belief is based on a huge body of science, not only in the academic literature, but from an Innerscope perspective, work we've been doing over the last 5 years. And we use a biometric belt that measures not one, not two, but 4 channels of medical grade information focused on emotions. So medical grade heart rate, skin sweat, respiration and motion. And then we combine that with eye tracking when necessary for a measure of visual attention. And we deliver insights to our clients that they can't get just using traditional measures. And we often hear how they go beyond traditional measures and help bring value to day-to-day business decisions.
So what led you to choose those particular methods? How did you develop them? How did you pick out those kind of tools?
Well, it's a great question, and I have an unusual path to market and media research. I'm a physician and psychiatrist and neuroscientist by training, and I was very interested from a research perspective in the patient-doctor interaction. And what was it about that relationship that went beyond the laying on of hands or surgical intervention or taking a pill that could still generate healing? And I started to ask people questions and realized that wasn't going to get where I needed to go. And started using skin sweat and heart rate, mostly because I couldn't take an fMRI machine and bring it into a doctor's office. And the EEG signals were full of gel, and it was a very complex signal. So I wanted to focus on emotions, and I wanted something that was very non-invasive. So I was running around the hospital wiring up patients and doctors and videotaping them, and found something very interesting, which was that there were these moments of meaning where the physiology between the doctor and patient would literally line up. And that correlated with the patient's perception of empathy. They felt heard, they felt understood, and we know that empathy actually is a big driver of outcome in medicine. What we didn't know is what drives it, what happens. At the same time, something very interesting was happening in neuroscience, and that was the discovery of the mirror neuron system. So it turns out there's this part of the brain that actually allows us to mirror the world. So when I wave my hand like this, the part of your brain that waves your hand actually fired imperceptibly at a low level, and that's how you understand that gesture to have meaning. So when I was teaching at the MIT Media Lab and met our co-founder Brian Levine, he said, "Hey, have you ever thought of applying this to audience measurement?" I thought, what a great opportunity to measure emotion on a big scale. And that's how we founded Innerscope.
So as you then applied those insights and methods to marketing, I think about the same time you said it's been 5 years.
Yes.
How time flies.
Yes, it does, yes.
I think a number of other companies sort of got into that field, but I think most of them use slightly different methodologies.
Yes.
So you already mentioned fMRI as something you consider, and there's EEG. How would you say, what are the differences in your mind with regard to what are these methods best at? And I guess you would probably want to say, what do you think the advantages of your approach are in that context?
So obviously we're biased, but first of all I want to say that we're all measuring the brain. Whether you're taking a survey or sitting in a focus group or lying in a PET or fMRI machine, ultimately we're measuring the brain. The question is, how are you approaching it? And I think one of the things that all of the vendors involved in the neurostandards collaboration and doing neuromarketing agree on is one thing, which is that we're all measuring the unconscious.
Right.
So the real divide is, are you using conscious measures or unconscious measures? And then once you get into that unconscious space, it's all about, well, what is your approach to the brain and what is your focus? And our approach to the brain is through the body. And the reason we focus on the body is that the structures that generate emotional responses are very, very deep. And they're very hard to get at through EEG. And what we're doing is attaching a belt, which is very easy to wear, and importantly, not very invasive. It takes a few minutes to put on. It practically disappears. In fact, in this conference, people are walking around with them, and you wouldn't even know it. So the form factor is important. It has to be natural, doesn't, no gel in your hair, nothing sticking on your head. Number two, the signals are very strong, and they're associated with what we're interested in, which is emotion. Again, if emotion's direct attention, enhanced learning and memory, and drive behavior, that's a great area to start to really get at insights. And we know that about unconscious emotions, and that's why we focus on them.
Now, when I met you a long time ago when I was still with NBC, was your system portable at that time already? Or is this like an advance?
So the big advance has been when we worked together originally on the DVR study, we had a vest.
Right.
And that vest had a computer attached to it. And you had to take your shirt off and put on the stickers on your chest, and they had glue on them. And it was a great device, but it took a little while to get on, and it was still a little cumbersome. So about a year ago, we migrated to a belt system. So there's a 0.99 correlation between the two signals because they're all medical grade. But now it's literally just a belt with one wire on your fingers. So it's faster to get on, it's more robust, and importantly, it's more portable and scalable. So we can send these things all over the world to do our testing.
And that's an interesting consideration.
Yeah.
Now, you alluded earlier to the Neuro Standards collaboration process. Yes. And you also just mentioned something very interesting when you said you compared the data you get from your two different systems, which speaks to an issue that was very, very frequently discussed at the retreat that we attended in discussing all these methodologies. And that's the issue of validation. Yep. So you just gave an example where you went from one system to another and compared it. In general, talk to us a little bit more about the issue of validation of this method. You said you've been in the business for 5 years. Some of the other companies 4 or 3 years. So compared to all the other marketing science that's relatively new, you just described how you're making advances, with the methodology. So talk to us a little bit about your view about validation. What have you found out? What is your approach to validate methods in the space?
Well, as a Harvard-trained physician and psychiatrist, I really only know one standard, and that's standards excellence. And so we try to bring that standard to everything we do, whether it's the quality of the signals, the quality of the study design, or the quality of the interpretation. We really strive for perfection and accept excellence as a result. And I think that's really important, just to set as a standard. But when we think about validation, we think of in terms of 4 pillars. The first is peer review. So prior to Innerscope, my work was published in top medical journals and formed some of the basis of some of our algorithms. There are literally thousands of studies using skin, sweat, and heart rate to measure emotions over the last 20 years. And Innerscope has published on its own as a company 4 different papers, one of which we published with you on the DVR studies, which I think was really important because it sort of showed the world that, guess what, people aren't skipping ads, they're actually paying high attention to them, they're processing them, albeit at a low rate.
Your findings were replicated by an academic in South Africa, and also by other networks around the world, which I thought was very interesting. Well, so that there's like a cultural element in our, how should I say, in the issues, the way you explain it to us, is that we're sort of like wired to scan our environment, even if we're not particularly focused on it.
That's right. We found that people unconsciously went into this hyper alert state. They stared at the screen and they were waiting for their program to come back. And that's a radical notion when you consider the options, which were to change the channel or get up and leave the room.
Well, what I found most compelling at that time when we decided to do the research with you was something that you briefly mentioned earlier, which was that traditional methods would not be able to get at that because people would not want to admit to or not even be aware of the fact.
Right.
And so that leads me to another point that was discussed at the retreat, which is, so what is the best way of using these methodologies? In the case where we worked with you, it was really that we relied very heavily on it because we felt traditional methods couldn't really capture this very well. But we did do something digital too, which was one-day recall.
That's right, next-day recall. Correct.
So is that what you usually advise your clients, which is to use your methodology as part of a mix of methodologies, or how is this usually approached?
Well, it's a great question. And yesterday we had a panel here at the ARF with four of our clients.
Which I saw.
Right, and it was really nice because they represented a variety of different kinds of companies, right? So Mars, a fast-moving consumer goods company. We had Intuit, which is an online financial services company. We had Invista, the maker of Lycra, which is an apparel company. And then, of course, we had Turner, which is another media company. And I think that's interesting because they all have different needs and they all approach things differently. But there were two common themes that came up on that panel. One was, the biometrics and the focus on unconscious emotions really go beyond traditional measures. And there's two ways in which they go beyond. One, they're a complement. In other words, they help understand the traditional measures. And two, they're an add-on. They actually go places that you can't go. And so I always tell clients, look, it really depends on the nature of the study, whether or not we're going to need insights from self-report or traditional measures. In most cases we do, but we have certainly done studies where we don't ask a single question. For example, our Super Bowl study a couple years ago where we measured the unconscious emotional engagement to the 49 national spots live as presented, and then used that to predict how many views and comments up to 6 months later there would be on MySpace. We didn't ask a single question in that study.
On MySpace.
Yeah,
See?
on MySpace.
It
So
does
that
go
was
back.
an outcome.
It was
That
a
was
famous
2008.
company in those
That's
days.
right. That was 2008. That's right.
So, go ahead.
But if I could go back to validation for
please.
a second. So, we talked about one pillar, which I think is important, which is peer review.
Right.
I think the second one is industry review. And I think that the Neurostandards collaboration has been an example of that. And Innerscope participated because of its commitment to quality, its commitment to transparency, and really its commitment to collaboration. But we're the only company that went that extra step. We've already done an ARF independent review. And what that means is we sat with the ARF and went through an 8-month process where they looked at our algorithms, they looked at our validation, they looked at our methodologies, and gave it a sort of stamp of approval. So we're very proud to be, I think the only company that's been through both of those processes, and we think every company should have that high standard. The two other pillars are, the two other pillars include, I think an important one, which is client review. Right, so I mentioned the panel where we've got four clients on the panel. We're also presenting with Yahoo and CNN.com, and we've been on stage with companies like eHarmony and Turner and even NBC when we're talking about our DVR studies. So we really think when clients are willing to get up on stage and talk about the results, that's important. And then the final one is partner review. We're very excited. Last week we announced a new global partnership with Ipsos. So we're taking an industry leader and their industry leading questions. We're adding the biometrics in an integrated way to really create something new, which is the best of self-report and the best of biometrics into a single product. So it's not an add-on. This is going to be new products for early stage and late stage television copy testing, for package testing, and for concept testing. And we're very excited about that because this gives us an opportunity to really go scale on a global level and build databases across the world.
Sounds great. Now, in the remaining few minutes, maybe we talked about validation, your science background, a lot of these validation issues and the processes that you've been supporting at the ARF. How about something really practical? To the extent that you can share information, can you give some examples of where you felt that your work really created some new insights, especially insights that were surprising and insights that you really don't think we would have gotten through other methodologies? I think we talked about one example, which is the DVR study, where you did find and documented how, despite the fact that people are only looking for the beginning of the program or the restart of the program, that they're still absorbing information that goes by in fast speed. Do you have some other examples of the work that you did that would be sort of interesting to mention?
Yeah, I think of our television advertising testing, and I think there are two things that people need to keep in mind. I think one, small differences can make a huge impact on advertising, right? And that can be the timing and pacing of the cuts. It could be the way the music interacts with the narration, and it could be the way in which the brand is introduced. So small differences can make a huge effect. And I think the other thing about television advertising testing we've learned is that, look, really it's about great stories, well told, relatable and compelling characters, and the integration of the brand or product or service into that story.
Okay.
And what often, we're all familiar with ads that we sort of, oh, that was a great ad, but can't remember what it's for, right? Because it's entertaining.
Right.
And that's a great story, well told, but it doesn't have the brand or product service integrated in it. So when we work with clients, we're always talking about the need to sort of, set up the brand as a hero and resolve some conflict, but do it in a way that's a great story. We often show an ad from Google that talks about a young man who's sort of searching. This is their Super Bowl ad from over a year ago, and he's online searching, and the whole ad is a search, right? And he's looking to study abroad. He meets a young woman. He learns to study French. He gets engaged.
I remember.
He moves to Paris, and then he has a baby. And he does all that in 60 seconds.
That was a good one.
That's a great story.
That was a great one.
And I think
it's all about the brand.
That's right. And storytelling and brand integration are key.
Did you find that in your Super Bowl study that sometimes, you read these ad meters or whatever, and people love a certain ad, but it's really only about the joke. But maybe the branding wasn't really all that good. Did you see that kind of gap sometimes appearing?
Yeah, one of the things we see when we compare traditional measures to the biometrics is that things that you're supposed to like, you will rate highly, right? You're supposed to like the Clydesdale horses, right? You're supposed to like a hero.
Social desirability.
Social desirability, exactly.
Yes.
And we'll often see, well, you know what, guess what? That's kind of flat or sometimes kind of low because it's boring. It's not part of a great and compelling story. And so we never see that self-report sort of undercalls and then the biometrics are off the chart. What we often see is that self-report's too high and the biometrics in reality are much lower. So we're showing a lower level of engagement. And again, that social desirability of sort of overrating things is very common. We do a lot of work in the Spanish language area, as you know.
Oh, yes.
And one of the challenges with the Hispanic population is that they're a very pleasing and excitable culture. On a scale of 1 to 5, everything's a 5. They're going to go watch it. They're going to go buy it. And it's very hard to discriminate because then the reality comes and that doesn't happen. And we see that across cultures and across products and across brands all the time.
Well, thank you very much, Dr. Carl Marci, for explaining to us where Innerscope uses their approach to bring new knowledge to the field of neuromarketing and to their clients. Thank you for your time, and thank you. Bye-bye.